I'm Penny Spring, Director of Public Health for Northumberland. I embarked on this new way of working with communities because some of the traditional methods that we'd used previously were having very little impact on health outcomes. We know that communities have the solutions to improve their own health and well-being, and sometimes they just need a little bit of support, direction, or sometimes even a small amount of money. So for me, it's going back to basics, going back to roots and connecting with those communities who have the power and the expertise to know what is best for them in terms of their health and well-being. We started having conversations with our communities. We started off in Berwick, we had a World Cafe, and a large number of local people who came and shared with us what helps them to stay well and what we as the public health team could do to improve that. And a lot of that was around giving them the opportunities to make that difference themselves. Social connectedness is really important to our communities. Having a friend, having a home, having a job are all important to communities. In public health, we can influence some of that, but we can't influence all of that. What we can do is help. It was really clear to me that local communities know what's best for them and know what needs to be done. And in many respects, they know more than we know in public health. We know what needs to be done to make a difference, but actually it's applying it to the local context.
I first became involved with this project really through Jane. Jane had the communication with the public health team. I thought it was a really exciting opportunity to carry on, continue the work that we were doing really, which was about supporting communities, empowering communities, trying to engage people.
Well, I think we all knew a whole range of issues for rural Northumberland, but it started to give some focus to the ways in which we might work with public health and with each other to do something about those issues.
Our communities were not shy in coming forward and telling me what they really needed, and that was an eye-opener.
We had a visit to see houses and there were various discussions, and the idea of having small grants that could be given out to community groups or potential community groups came up, and I was very interested in it and offered to get involved.
So one of the things that we did was to look into developing a system of micro-grants for communities whereby they could give out small amounts of money to community groups to do things that would help increase their social connectedness.
It was interesting to set up the grants in the first place because we started with a blank sheet of paper and a sum of money. So we set the amount at £100. We thought that was neither too high or too low, and it's worked out to be a good figure.
Types of projects, well, I mean, it's so wide, it's not true. And I guess one of the delightful ones is the free food project, where people are picking up stuff from the hedgerows and windfall apples and making juice and giving it away for free. And those kinds of initiatives, which have just been super.
The project's been very interesting to administer. The actual process, the grant process, was relatively simple. Certainly the applications were relatively simple. We did need to coax a few people through the door to get things going. That's fairly normal, but once it's taken off, it's taken off.
We had to develop, sit down and think, how are we going to let people apply for this? What are we going to need to know? How we wanted to keep the administration costs down, so we did everything electronically by email wherever we could.
I don't think people are finding it difficult. It's a very simple process, and we're not asking a great deal of people. And so in our case, we've had 27 applications that we've agreed, and we've got 3 in the pipeline.
We redesigned the application form 3 times because we found that perhaps people misunderstood one of the questions we'd written, or we weren't getting sufficient information. And again, we asked them to give us feedback after 4 or 6 months and how successful it's been and whether they were still going. And we had to alter that slightly. It has taken quite a bit of time because if you're doing something from scratch, you've got to keep it, give it all your attention. And it has taken up a bit of administration time for our admin worker. The feedback I've had from those that applied was they found it quite easy. They didn't find it onerous. But when they have filled them in, it's all been very positive. I haven't seen a negative feedback form yet. I think the projects, the groups that have been formed have tackled social isolation, which is a big problem in Beadnell houses in Bamborough during the winter. We have so many houses which are second and holiday homes and are standing empty that in some streets, there's maybe only 2 houses occupied, and it's difficult unless you have a car and the resources to be able to get out and mix with people. Anything that brings people together and allows them to laugh and get interested in things and work for their own community, whether it's planting bulbs or picking up litter or painting a shed or something like that. It's the feel-good factor, isn't it? It makes life worth living.
Relationships are absolutely crucial to this. I have no doubt that had the community has not trusted me and what I stand for and what I wanted to do, then it wouldn't have happened. Trust is really important, and also having integrity and delivering on promises. That was very important to me, was delivering on my promises. So I didn't say public health will do X, Y and Z. Actually, we did it, and that has made a huge difference. And now we're able to work more with those communities to do even more great work. Although they're doing the great work, we're just facilitating it slightly. I have been so impressed and inspired with what our communities can do on a relatively small amount of money.